name is Joe Montano. I'm the Director of Hearing and Speech at Weill Cornell Medical College in New York City, and I'm here to talk a little bit about family-centered care. Often people ask me when I give a lecture on the topic how I could evaluate a patient and have their family in the room at the same time with a limited amount of time. And we're all pressed for time. Our clinics are busy. At Cornell, I have the same time constraints as anyone else has in any kind of practice. And what I do actually is just prioritize what it is that I need to find out. Many times we put a lot of effort into explaining the audiogram. The audiogram is a piece of information that's important to us, but it's not that important to our patients. They already know they have hearing loss. That's why they're there. So my thoughts always are that the audiogram, we don't have to really concern ourselves with. We want to know, who is this person, who is their family, what is their communication network. That's what I want to find out. By embracing the family structure, by inviting the children of the parents, the children, whoever it is that are part of that network, it gives me a lot of information. It gives me information that I would never find in a standard health questionnaire. If I ask, do you have ringing in your ears? Are you dizzy? That information is a yes and no answer, and I don't know anything about their communication. So when I structure my interviews, I always do open-ended questions. Ask questions like, tell me a little bit about your hearing, how well, can you communicate? Tell me where you communicate effectively, where do you have difficulty? And I always invite the family to join in. What's important to always remember, though, is that the patient is who you're going to be working with initially, even though you actually work with the entire family. So when you invite family in, it's important that they know that they're going to be part of this process, and that we don't, so this way they know that they're going to get their chance to speak. We're going to invite them to participate, but first we're going to take a little time and we're going to talk to the patient directly. I think that's very good. I've been practicing for a long time, and while we always hope that this is going to work effectively, sometimes it doesn't. Sometimes we have difficult, spouses, or we have situations that are a little hostile. But that's very rare. And then we have to deal with it. We have to deal with that as counselors of hearing. And that's just part of our jobs. That's part of what we do. The real positive part of this is that I get to learn interaction. I develop a partnership. The partnership is me, patient with hearing loss, and the family member. Sometimes it's a spouse, sometimes it's a child, sometimes it's a friend. Whoever that person is, that is what we would refer to as that family structure.